for having this time and welcome to our podcast of Connected Health.
Thank you for inviting me here. It's a pleasure and an honor to be invited to your podcast.
Yeah, the honor is ours because we have been working together with also like the team for the last month. And we are very happy to hear your opinion about this world of connected health, the cases of use on cardiology, and also your experience, but also your thoughts and the vision that maybe you can have, yes, of the future and the present of connected health. So first of all, based on your experience, well, we would like to hear more about you, Dr. Drove, and we would like to start by sharing a little bit about your journey in medicine. What drew you to specialize in cardiology, and how did you plan your career plan and also like your career in Colentina Hospital?
Thank you. This is a very good question to begin with. So I'm a resident doctor in Colentina Hospital. I'm in the 5th year of residency in cardiology. My journey in medicine has been driven by a deep curiosity about the human body and the passion for solving complex problems that started a really long time ago. From the moment I began my medical studies, I was fascinated by the intricacies of the heart and how this powerful organ and pump in our bodies can sustain life to its rhythmic precision. Cardiology stood out for me since the days of the university as a field where you can make a tangible difference, not just in moments of crisis, but in the long over the long time that a patient can have a cardiological disease. Because in cardiology, many times you have a patient for life. That means you're treating this patient over a decade or two. After completing my medical degree, I knew I wanted to dive deeper in this field of cardiology. And in my opinion, the complexity of the cardiovascular diseases and in the rapid advancements in this field drew me more into it. I pursued further training, especially in heart failure, particularly in patients with reduced ejection fraction, and they become a focal point of my studies. My path led me to Colentina University Hospital, which is located in Bucharest, Romania, a place which is known for the good care that is provided to the patients, the commitment to innovation. And I found there an environment that not only supports research, but also encourages the application of new technology.
For sharing this vision, I think that Colentina Hospital is like very advanced hospital and it's in the front of the innovation and also like the implementation of this. And yes, and well, of course, like you have been using Vitalera and you know like Vitalera, and I know that now you are also going to use Vitalera for heart failure patients too, so it's a continuous work. And about this experience, well, for maybe those that maybe not are familiar with Vitalera, we would like to hear from your experience and also from your thoughts. Yes, how has been like this experience, and how is this experience by using this remote patient solution, and especially also which is like the impression and the experience of you as a doctor, but also from patients. Sometimes it's like very difficult for us to contact them for compliance, but it's very rewarding to hear from your experience. So I don't know if you please, Dr. Drove, can you explain to us which are your thoughts and also like your experience with Vitalera?
Okay, thank you. At first, I want to explain what Vitalera meant to me and what we are using it for. I'm sure you can do it way better than I can from the developer perspective, but I'll try to do it from our point of view. We see it as a really innovative digital platform that we integrated into our treatments and monitoring of the patients, particularly really for those with heart failure with reduced ejection fraction that were admitted to our hospital because they had a decompensated heart failure episode. Practically, it's an app that it's installed on the patient phones, and it is connected with various devices, including a blood pressure monitor, a pulse oximeter, a scale, and a Fitbit device that receives and that is connected to the phone and receives a lot of data from the patient. This is really important for us because it tracks the vital health metrics like blood pressure, weight, and blood oxygen saturation. And it transmits the data directly in a digital platform that we can use to monitor the patients after their discharge from the hospital. And for the patients with heart failure, this is quite transformative because the last guidelines recommend treatment, a certain treatment for patients with heart failure, but this allows us to monitor patients remotely and to see what patient responds better to the treatment, and we can detect potential issues early in the development of the disease and intervene before they become serious. For example, a proactive approach that we use has significantly reduced the rate of hospitalizations for our patients. The approach was if we send a patient home with a certain treatment and they grew out in, for example, 2 or 3 kilograms in weight over the 5 days, we are going to ask them to come back and see what didn't work at home and why they need another medical intervention. Something that really helped us, and we reduced a lot of days of hospitalizations from patients that were included in this trial. And also it helped us empowering patients to take an active role in their health, and we are also it enabled us, the medical team, to provide more responsive care. I mean, now we are more connected with our patients. We can see our patients progress from far away. They don't need to come all the time to the hospital, even if they feel bad or they have a certain problem. So I believe that Vitalera is helping us bridge the gap between the hospital visits and the everyday lives of the patients. And it also ensures our patients that they receive a continuous treatment and care, which is personalized even outside the hospital's walls, which I think is truly great, and it's the future of medicine, so to speak. The personalization of treatment, I think, will be the next step in heart failure and heart failure treatment evolution.
You have mentioned something like very interesting, which is understanding with like data what is happening out of the clinical setting, out of the Colentina hospital, right? And use that data for making this personalized care and even treatments, which is something that that it's very interesting. And also I know that we have been like the platform has been collecting data for that, right? And that it's useful for avoiding readmissions and hospitalizations.
Yes. Some benefits that we didn't saw at first was the fact that the data that we received enabled us to increase the patient's treatment way faster than we used to do. For example, the latest guidelines recommend for patients with heart failure with reduced ejection fraction a certain treatment form from 5 active substances. We should give to the patients all the active substances, but the problem is that a lot of patients are having hypertension and they cannot receive all the medication. And Vitalera helped us in this situation because we saw the blood pressure of the patients at home. So we were able to know when we can increase the doses, at what period of time, if we can increase the doses, and if that patient is doing fine with these changes in his treatment. Also about diuretics that are really important in the acute setting of aggravated heart failure. If the patient was performing a little on lower number of steps than before, or they started to gain weight, we knew that something is off and we should intervene. So we were calling the patients, talk to them, see what's the problem, and maybe change the treatment a little. For example, sorry.
No, it's very important, because there's like a kind of early intervention and prevention.
Exactly. For example, I'll give you an example from one of our patients. It's a patient with a very severe heart failure with a low ejection fraction. The ejection fraction is somewhere around 15 to 20%. So he had a lot of events in the past year, and we decided to include him in this study. And he at first he was not very happy with the program. He said that it doesn't have it. He didn't want to use it because he felt like he's too unhealthy for it. And at the end, we convinced him to use it. And what we saw is that it empowered him and gave him a lot of information about his disease, because monitoring his condition daily made him observe and understand his condition better. And when, for example, he gained 1 or 2 kilograms, he already started to call us, or he tried to reduce the salt in his diet, or call us to increase the dose of furosemide. Also, he was doing more steps every day because he saw how many steps he did the day before, and he wanted to do more than the day before. And overall, over a period of 6 months, we managed to reduce the number of hospitalization for this particular patient, which was a severe one, only because we enabled him to see his disease and understand his disease better, something that helped him a lot in the progression of his disease. It's still severe. I mean, it's not way better than before, but from a clinical standpoint and for what he feels better than it was 6 months ago. So this is a great plus for us, in my opinion.
And for us, it's also like very rewarding, I have to say, because we know that sometimes like patients that, of course, and technology sometimes it's not like maybe the first option, but with them, but it's very rewarding to listen that it has empowered him, and also that his opinion has changed after using this program, and the data has changed also.
Exactly.
It is very rewarding. And also, Dr. Drove, I think that sometimes we speak a lot of the benefits, which is of course like very good, but also we would like to hear, because from challenge we always learn and we improve, about also which are like
I understand your question, and indeed there were some challenges, especially because we have a large number of patients that are older patients that are not used to technology, and indeed integrating Vitalera into the patient's care was exciting, but also challenging endeavor. Initially we had to navigate as all the people with the learning curve that comes with introducing a new technology to the patients, but also we had to work a little with the patients themselves in convincing them that this is useful. Using technology will have benefits for them, and spending that little time every day to measure their blood pressure, to weight themselves, to wear the bracelet, it's really important for them. We should also, another issue that we encountered was the problem with the devices, like the patient's devices, because some of them have the appropriate device for the app, but they don't know how to use the device, and we had to learn them during the hospital stay, how to use Bluetooth, how to use the app, how to use their cell phone practically. But in the end, we figured out that patients would benefit from this, and we also figured out what group of patients would benefit the most from this, and who will actively can use the apps at their full potential. And we tried to include these patients. Because, for example, although we had patients that were 88 years old, some of them really wanted to learn and wanted to be a part of this project. And we stayed there, we explained, anyway, the program is really easy to use, but it takes a couple of, let's say, days to get used with all the steps. And if they do 1 or 2 tries, I'm sure that it will be enough for them. What they have to do. Sorry.
Yeah, sorry. No. I'm glad to hear that, but also I'm glad to hear that finally after this they could use
Yes,
it.
yes. Most of the patients could use the app easily from the beginning, but at the older generation, it took, let's say, 1 or 2 tries before they were able to use it at the full potential of it.
Yes. No, even
What?
that I have. Oh, sorry.
Sorry.
No, I
No,
have to say
please.
that we have done like some like new features that we will learn soon to solve that problem, and it's very appreciated to hear your feedback and the patient's feedback, especially the older one, the older one that they have.
Yes.
It's like learning curve, at the beginning.
Yes, but all of them use it after a few tries without any issue. I mean, we have the oldest person that used the app is 91, and
91.
he's really happy with the app, and he uses it daily, and he wants to continue to use it because for him it really changed the way he saw his disease, and also the fact that he's under continuous monitorization brought him a lot of joy and empowerment. He even said that he wants to go back to dancing, which I found it really cute for his age. But it's something that brings a lot of joy to him, and definitely increases his quality of life.
Yes, and also Dr. Drobe, I have to say that for me, this is making my day because it's very rewarding to hear that a 91 years old patient is using this, and now she wants to keep like dancing. I think that this is like very rewarding for the people that we're working on this, and it's very nice. So thank you so much for sharing this story.
Yeah, another issue that we saw from the patient is that they saw themselves that the period of rehospitalization was reduced. I mean, we've observed a significant reduction in the rehospitalization rates among patients that use the program, but also we need to monitor them. What's really important and what we saw is that their satisfaction was noticeably increased during the use of the app. Many patients appreciate the continuous connection to their healthcare team, knowing that they're being closely monitored, even if they're not in the hospital. And this ongoing support was really useful in reducing the anxiety that comes with the disease. We had a lot of patients that were really anxious. They didn't want to go home because they felt like they need a couple of more days in the hospital. But this situation only came from their anxiety. And after we introduced this system to them, they were more than welcoming for it. And there are, again, some of the patients that really benefited from this.
Which is very nice to hear. And also, I would like to ask you, which is your impression about the patients' outcomes? We have heard like the feedback, but have you measured also like the satisfaction with these patients and the use of Vitalera? And what are your thoughts about their experience? We have already speak of some of them, but I don't know if you can share like a general overview of them.
The response from our patient was generally good. I mean, we had a lot of positive feedbacks. Many of our patients were initially apprehensive, as I said, about using new technology, especially about the fact that it required daily engagement, and it was actively involved in their day-to-day management. But after they used the app and they saw how easy it is to use the app and how easy it connects the patient with the healthcare provided, they became more confident in the app, and they started to like it a lot. A lot of patients even said they are using it, as I said earlier, as a way to provoke themselves in doing more steps, in trying to reduce their weight. And the fact that they're using it daily, it's really important because it emphasizes the fact that they need to do changes in order to maintain a better lifestyle. I mean, what I believe this app brings to them is the fact that it enables them to be more active and more involved in the in changing their lifestyle. Basically, using this changes a lot of their lifestyle. It doesn't change the medication that they are receiving. Is the same medication that we saw with the patients that we included in the program, that we had fewer hospitalization, fewer hospital stays, or fewer hospital day stays, and it's really important. And also the patients saw this. There are some patients that were coming frequently to the hospital, and their interval between rehospitalization grew and grew after using this app, and after they been able to monitor their health and better their situation.
And about the impact on your clinical practice, how do you think that solutions like Vitalera have changed, or how Vitalera has changed your day-to-day clinical practice, and also like the way you care failure patients?
Practically, this helped us a lot in reshaping our day-to-day activity, because it helped us monitor and manage our heart failure patients more easily. A lot of things changed during the past few years in medicine and in cardiology, but we never knew what the patient is doing at home. Or the only way you knew what he's doing is by asking, and you were never sure that he's telling the truth or he's not forgetting anything.
Absolutely.
Well, with this, we don't need to worry about that. Traditionally, our management in heart failure and with these patients was relying on periodic checkups and the patient reporting the symptoms only during their visits. But with this, we have the option for them to send us feedbacks and respond to questionnaires about their health, and we can see changes in their health in real time, which is really effective and often help us with providing the medical care. Indeed, the old way of doing things was also effective, but it left gaps. For example, maybe in a day the patient was having a low blood pressure, and he might have forgot to tell you at the checkup, the next checkup, and maybe you wanted to increase his treatment during that following checkup. And now we don't have to do it, because we can see it on our phones, what he did, how his blood pressure was at home. And in my opinion, the continuous stream of data provided by the app allows us to monitor the patients in real time, which means that we can catch early warning signs much sooner than we could do with traditional methods. For example, as I said, if a patient's weight starts to grow and increase rapidly, or if their blood oxygen level starts to drop, or if they are not sleeping well at night, they're having a lot of wake-up hours during the night, we can see, and we can ask them what's happening on, or if they need some help from our side. In my opinion, this is a shift to a more proactive care that influenced our approach and our patients' health to a better health system, and made us more focused on the prevention and early intervention in the disease, rather than just managing the symptoms after they appeared. It also allowed us to personalize the care of our patient more than we used to do before it. Our treatment plans now are tailored more based on real-time data that we receive. Making adjustments, it's also more easy than it was before. And the most important thing that this brought to us was the improved communication that we had with our patients, because being a big center and having a lot of patients doesn't give you too much time to communicate with every patient when he's not at the hospital. So because of this, we have better communication with our patients, and they're feeling more close to their health care provider. And in my opinion, this allowed us to have a better dialogue with our patients and enhanced in some way the quality of care, and also build a stronger relationship with our patients, which are more prone now to give us more data about their condition and are more open to investigations and recommendations.
Yeah. So thank you so much for sharing this, and also I think that we have to speak about like how Vitalera can improve like the quality of life, hospitalizations, and I like very much this approach of personalizing the treatment because
Exactly.
I think that one size is not like the same for all, right? And
Exactly.
yeah, and in this case, I think that especially in heart failure, it's very important to customize the programs, the alarms, and the treatment. And yeah, and also just for finishing, and because we don't want to give you too much time, I think that it has been like very very like yeah, very important, and also like very advanced experience that you have, and also because you are doing now the PhD on that. Which is your thoughts about the future of all of this? Like the future of medicine will rely just in tools that will support like the care of patients. Do you think that this kind of partnerships and also like these collaborations are part of the future? And yeah, what are your thoughts on the future of medicine with remote patient solutions that are validated and are already like interoperable?
Yes, definitely. The collaboration between healthcare providers and the technology companies is mandatory in the future. For example, the heart failure, and one of the biggest challenge in heart failure is and its treatment today is the complexity and variability of the condition. Heart failure, as you said, it's not one size fits them all diagnosis. It affects patients differently, and you can use different treatments depending on a variety of factors, including the underlying cause, the presence of comorbidities, and the patient's overall health and lifestyle. This complexity makes it difficult to develop a single therapeutic approach that works for everyone and everything. And in my opinion, it requires a more individualized treatment plans. While the current therapies have significantly improved the management of heart failure and extended life expectancy, there's still a lot of gaps that we need to fill in order to meet all the needs of our patients. The integration of the technology, like Vitalera programs or other programs, it's mandatory for the evaluation and monitorization of the patient. It helps us to bridge some of the gaps by providing this continuous monitoring at home for the patient. And in my opinion, another technology that will help us a lot is the AI that will bring the power of the predictive analytics to the table. I mean, it will help us use big data analysis in order to evaluate a lot of patients, a lot of therapeutic strategies, and I believe you can certainly explain better than I do that AI can identify patterns that might not be really apparent to the clinicians. This can help us predict, for example, which patients are at the risk of worsening symptoms or hospitalizations, and it will allow us to tailor a better intervention for those patients, which will be more precise and effective.
Yeah, I think that this is a very promising area of these like AI predictive models, and this is the next. But yeah, and this is like a good way of I think that of understanding the value with the things that you have been doing. And yeah, so I think that we are like over the time, and I want really to appreciate and to thank you again for making the time. I know that you're in the hospital right now, and for us it's like a very yeah, like a very big pleasure. I don't know if you want to give any advice for young cardiologists, maybe like people that are in starting, deciding, or anything to close, Dr. Drew.
Yes, regarding the young cardiologist, it's quite interesting because as I am a young cardiologist myself, my advice is to stay curious. all the time and embrace innovation. I believe that we should not be afraid to explore new technologies and how they can enhance the patient care. I believe that focus on continuous learning, not just cardiology, but also the emerging fields like digital health and artificial intelligence is important for the clinicians in the futures. I believe that the collaboration is key, and working closely with tech experts and engineers will make us understand that there are tools out there for us to use in order to help our patients more effectively and treat them better. Most important, I want to mention that we need to keep patient-centered care all the time at heart, and everything we are doing for the patient. Technology should always serve to enhance the human communication and should be used in order to save more patients and help more lives.
That's amazing. So thank you so much for sharing this. It has been a big honor, and working with you is an honor. And yes,
the honor is mine, actually.
Yes. No, and thank you so much again. We will continue our series of podcasts, and of course, this is something that we will share with our cardiology community. So.
Thank you for inviting me here. It was a great pleasure of being here and letting me put my thoughts out there. It's been an honor to be here with you and working with you in this program. And also, I believe that the continuation of collaborations between technology companies and clinicians will be beneficial in the future.
Of course they will. And thank you so much again, Iusti.
Bye-bye.
Bye-bye.